So today I'm going to be talking about the management of heavy menstrual bleeding. So firstly, before I start, I would like to ask you this question. Are you a female who normally reports bleeding more than 7 days? Or are you a female who normally reports heavy bleeding during your menstruation? Or are you a female who do rely heavily on tampons or pads? When if you use a lot of pads or tampons during your menstruation, then you are most likely suffering from a condition referred to as menorrhagia. So, what is menorrhagia? Menorrhagia is a condition whereby you have an excessive menstrual bleeding, usually more than 7 days, and the bleedings are usually heavy. So, let's get started. So, what are the management? Firstly, the use of NSAIDs. NSAIDs are referred to as the non-steroidal anti-inflammatory drugs. You can get most of these NSAIDs over the counter, like ibuprofen, like Motrin, like Advil. So these medications block what is referred to as the cyclooxygenase. So when they inhibit cyclooxygenase, they actually reduce the production of prostaglandin. So what prostaglandin does, decreasing prostaglandin does, is that it balances the ratio of prostacyclin and thromboxane, which in turn reduces heavy menstrual bleeding. And also, it's been reported that in individuals who uses NSAIDs, it's been reported that most of these individuals, in 20 or 40% of cases, they've reported increase in their well-being, which means stabilization of the menstrual flow during menstruation. And also, you have to be careful about the use of NSAIDs because of its associated side effects, and especially side effects like gastric ulcer and kidney. You have to be careful. So you don't want to use NSAIDs excessively for more than 5 days. Another thing that you can use are oral contraceptives. So outside the fact that oral contraceptives do help to prevent pregnancies, it's been reported that they help regulate menstrual cycle, and they decrease the incidence of excessive bleeding. Another medication you can use is oral progesterone. Oral progesterone has also been reported to be of benefit in this kind of individuals because they regulate hormonal level, and thereby reduces the incidence of excessive menstrual bleeding. Another class of precautions you can use are the hormonal IUD. Hormonal IUD like Liletta or Mirena has been reported to release a type of progestin called levonorgestrel. So levonorgestrel in turn causes thinning in the lining of the uterus, which actually reduces menstrual flow. And also, if your medical provider sees that during this period you've actually lost a lot of blood or decent amount of blood, and there is a decrease in your iron level, they might actually recommend the use of iron supplements, which will help you. So what happens when all of this management fails? Now the next stage is surgery. Surgery such as D&C, dilation and curettage. So with the dilation, they dilate your cervix and they scrape the lining of your uterus, which can help to reduce the incidence of heavy menstrual flow. And also with the use of uterine artery embolization, especially in patients with fibroids. And also in patients with fibroids who desire to have kids, they can do what is called the myomectomy. Myomectomy is a procedure done in this kind of patients so that it can actually reduce the incidence of heavy menstrual flow. And also, there are other procedures that your provider can recommend, and if all of this procedure fails, then the last result would be surgery. I hope you are able to learn one or two things, and hopefully you take care of yourself.